What are the common symptoms of amyloidosis?
So things that should prompt us as clinicians or even patients to think about amyloidosis, there's a pretty good list. And these are all things that really, as an oncologist or hematologist, as we're seeing patients, when we see someone with a new diagnosis of, let's say, smoldering myeloma or multiple myeloma, if they have these other red flag symptoms, then they really should prompt us to think about amyloidosis. And these are often things that we see in amyloidosis that we really don't see in myeloma. So the various items that I would typically think about would be heart failure. So somebody with a new diagnosis of, again, smoldering or active multiple myeloma who has new heart failure, so shortness of breath, peripheral edema or leg swelling, or other signs or symptoms of heart failure, or electrical trouble in the heart, so what we call arrhythmias, so basically short circuits or abnormal heart rhythms. Those things are often red flags for amyloidosis, not always, but we should think about it. Someone with multiple myeloma who has in what we call nephrotic range proteinuria, which just means a lot of protein leaking out from through the kidneys into the urine. That's another thing that typically doesn't happen in multiple myeloma. If it does, it should prompt us to think about amyloidosis. Someone who has a lot of neuropathy, so numbness and tingling in the fingers and toes. A little bit of that goes with myeloma. A lot of that, especially if accompanied by severe GI symptoms like constipation, diarrhea, or really low blood pressures. Those are all things that could indicate different patterns of nerve injury, and they should prompt us to think about amyloidosis. Tongue enlargement, so it sounds strange, but when people have amyloidosis of the light chain variety, one thing that we sometimes see is enlargement of the tongue as that protein deposits in the tongue. And so it causes significant tongue enlargement and can even cause trouble with swallowing for some people who have it severely. That's another red flag symptom. And so you get the sense from this list that there are things that we see, that if we see them in somebody who has a diagnosis of multiple myeloma, we really need to think about whether there's an amyloidosis component of it also.
So the most common symptoms of amyloidosis include protein in the urine. We're referring to albumin in the urine rather than excessive amounts of light chains in the urine. That's a big red flag. Peripheral neuropathy in a stocking glove distribution, usually sensory, is common. That can look a lot like the neuropathy people get from chemotherapy, so that may be hard to pick up or recognize as being related to amyloidosis. Another potential symptom, if the amyloid affects your heart, is congestive heart failure. So any patient who develops unexplained symptoms of congestive heart failure during the course of their treatment for multiple myeloma should be screened or evaluated for the possibility of amyloidosis.
What are some symptoms of congestive heart failure?
So symptoms of congestive heart failure could be excessive unexplained fatigue or exercise intolerance, shortness of breath, particularly if there's fluid accumulation in the lungs, or progressive swelling in the legs or edema that doesn't have another explanation. Usually congestive heart failure is associated with chest pain or anything like that.
Where can individuals find additional resources on amyloidosis?
So the patient advocacy groups, the Amyloidosis Foundation, the Amyloidosis Research Consortium, and the amyloidosis support groups, the major patient advocacy groups, have wonderful websites. Many of the hospitals, Tufts, for example, Mayo Clinic, Boston Medical Center, Memorial Sloan Kettering, Columbia, have websites which are very informative. The National Cancer Institute also has a fairly good website on amyloidosis. There's a lot of information online. Some of it is a little outdated, but the symptomatology that's described is still accurate.